Here's how to set up your Donjoy TROM Advance / TROM Adjuster. I'm not a medical professional, and so you should of course consult your doctor, physician assistant, etc. But here are some basics on how to get it to fit right. Again, consult with an expert. Now the parts are basically this. You've got essentially a metal framework here that's basically a metal frame with a hinge on it that's adjustable. And of course various support pads, 1, 2, 3, and 4 on either side. Now the center part here of the brace, you have a strap that holds it to the back of your leg, and you'll have these little basically sticky pad things with some Velcro. Now what you want to do is position them so they actually contact the back of your leg, holding it in place. As you can see, they've got little ridgy things on them to prevent you from sliding around. Also, there are these various pad things, and they are attached with Velcro also, so you can pull them off to clean them. And of course, since you'll be sweating into the pads, eventually your brace setup will start to smell, well, rather bad. Now, in terms of positioning these, the main idea, of course, is to get them to protect your leg from this plastic stuff, because you don't want this grinding into your leg. And essentially, you just sort of position it so you've got the pad over it. And you don't want it to go too far, because if you have it stuck down here, then end up making it too thick. Then essentially you take your leg and you put it roughly into the center. Now, when you are setting up the straps, and as you can see, they have the little plug-in things and the little connector on the other side. And the way they're set up properly is you have the following stuff. Now on the back side, bring this around a bit, you've got a Velcro attachment that is separate, and you'll take it and attach it to the end of the Velcro strip, or the little strip thing. And of course, if the strap is too long, you'll want to trim that and place it on there. In my case, I didn't trim mine because my leg's adequate size, and also I didn't really feel like slicing it up. And so this folds around under it and attaches over here. Then over on this side, you've got it coming around to here. And then basically what you do is you strap the thing onto your leg, and I'll turn off the camera while I do that because I can't hold the camera and work the leg at the same time. Now this is the brace actually fully in place. Here's the lower one, which goes about the ankle level, and these are adjustable. You can slide these. And then here's the one that goes below the knee, and there's the knee with the scar from our operation, and here's the upper one and the uppermost one. Now in terms of positioning for these things, you want to adjust it again according to your doctor's instructions or physician assistant instructions. The way I positioned it is to have sort of a maximal extension, because it's a simple matter of physics that if you have it too close together, you're not going to have as much support from the brace. So I have it, and I'm fairly tall, about a bit over 6 feet, and so mine is pretty much fully extended. Now the top part of the brace is over here, and you can see there's the top part. It's the plastic is capped on the end, and then down here at the bottom there's an opening there. And also in terms of the positioning, this is how it should be on your leg. Here's the adjustable thing for adjusting flexion and extension, and here's the knee, and this thing should be set so this part is on top and this part is on bottom. And it should be positioned so this thing is roughly centered on where your knee bends, otherwise you won't be bending very well. The metal struts here can also be bent to adjust to provide support, such as if you have like an ACL tear and you need to avoid having your leg wobble from side to side. In my case, I had the joy of getting a quadriceps tendon repair, so the side-to-side motion is no problem because my ligaments are all intact. I just have to keep my leg from bending too far to tear that repair, because that would be pretty sucky. Now, the feature here is one of the most important parts of the braces. As you can see, there is a slider here, a slider here, a little thingy here, and some numbers along here. What does all this stuff do? Well, this thing right here adjusts the extension. And extension is basically your knee going up, or your leg rather, going up like this. So in a functional leg, this would be extension. Bending the knee, or bending the lower leg going up. Now, depending on the type of injury you have, you may want to have, full extension, in which my case I could, which allows you basically to have the leg perfectly straight. And of course, it can be adjusted to have less extension. And to adjust this, you simply push the button in and slide it around. Now, the other adjuster over here is for flexion. And flexion is basically, in this case, bending your or moving your leg back. So on a functional leg, when you take it and bend it like this, that would be your flexion. And it's adjustable from 30, which is the lowest setting, all the way up to fully open, which allows it to bend, as far as the brace can go. And the way you adjust that is simply push down and slide to the appropriate thing. And it'll actually prevent the brace from moving past that point. Now, your doctor or physician assistant, whoever is handling this professionally, will set that for you. And you don't want to screw around with that, because if your leg bends too much, you could damage the repair, and that would be bad. Now, initially, for most, in my case, the quadriceps repair, your brace may be locked. And this little button here allows you to lock it in place. So you just slide it up, slide it in, and it is locked. And again, if that's set by your physician, you don't want to mess with that. Now, in terms of adjusting the parts of the brace itself, what you do to make it longer or shorter is you simply push in these little gray buttons here, and it allows you to simply slide it. And there's a button for each thing. And you push it and just kind of move the thing around and adjust it based on your height, etc. And you want to make sure that these things are locked into place. You don't want them sliding around when you're trying to get about. Now, as far as the brace looks, to get a sort of a camera around the brace, here's basically how the straps should be. On the top part, the buckle should be here, the top part, and then the strap should go around the brace and then around like this. I'll do a little fly around on the brace. And assuming I work the camera okay, that's what it should look like. And so essentially that is the setup for the brace. Again, consult with your medical professional, put it on to make sure it's properly done, but that is the joys and fun of the Donjoy brace. I certainly hope that you don't actually have one, because it means that you had some sort of knee surgery, which is really unpleasant. But if you got one on it, so far it's been a pretty good brace. It costs $500, so it should be pretty good. Or, anyways.